FORA.tv. The world is thinking.
I see a decreasing number of people actually talking about health care on the congressional side as a commodity. I mean, it does seem to me that the presumption that it's an essential human right is embedded in most of the arguments that are being made for reform. Is that correct, or is there a disagreement about whether it's a commodity to be purchased versus a basic human right?
I think the senators believe that every American should have affordable, quality health care and speak of it in those terms. The difference emerges in how best to provide that. Is it best to provide that through governmental programs like we have Medicare, Medicaid, children's health insurance, state-based programs, or is it better to provide that care through the private sector, nonprofit organizations, or for-profit organizations? And that's where the debate really seems to be centered.
And to be clear, over the past several years, there really has been tremendous progress in getting consensus around the idea that everyone should have coverage on both sides of the aisle. And I think the Finance Committee is working with Republican members on their committee that believe the same thing, and I think that that's a real step forward from where we were, and that's a real difference from 5 years ago even, that everyone is talking in the construct that Republicans and Democrats, that everyone should have coverage.
But in addition to that, going back to what you said earlier, Senator, about the cost to individuals, what do they need to do? We're also exploring something that is new and different, which is requiring people to have health insurance coverage. Both bodies, all the committees have looked at saying we are going to expect that everyone will at least have some type of minimum coverage and be expected to go out and get a policy. Now that will be provided either through the private sector with some government subsidies for lower income people, or provided through your employer, or provided through Medicaid or one of our other government programs.